Hi, I'm Dr. Soumya, obstetrician and gynecologist and laparoscopic surgeon at Cloudnine Hospitals, Hyderabad. Vaginal bleeding in first trimester. Most of them come to us worrying, asking whether I am ending up in a miscarriage because I'm having bleeding in the first trimester. But the thing to know is not all bleeding will lead to miscarriage. So there are many reasons for the bleeding in the first trimester because your cervix and vagina are very sensitive. Even for the pelvic examination or the intercourse, you might even bleed. That's bleed on touch. The most common reason for vaginal bleeding in first trimester is the implantational bleeding. Because before the egg has been implanted into your uterus, if there is any mobility, that's where you will even see the vaginal bleeding. What exactly your doctor will advise when you have a vaginal bleeding? They usually ask you to avoid lifting heavy weights. And when you come visit your doctor, they'll have an examination over you. They'll order a few tests as well. They are the ultrasound, and even sometimes they might check with a Doppler also for the baby's heartbeat. They make sure the baby is doing fine inside, or there is any hemorrhage or the bleeding collected posterior to your placenta. They even check that. So the Doppler, that's a machine only used to see a baby's heartbeat. Usually it is carried out after 11 to 12 weeks of your gestation. What treatment will be given to me? There is no specific treatment that have been shown proven to be effective in the case of vaginal bleeding. Usually to continue your pregnancy, your doctor might start you on progesterones. And if you're bleeding excessively, that's where your doctor might even start you on something called as tranexamic acid also, depending on the situation. Now, the other reasons they come up and they ask is, ma'am, I'm having a bleeding. Is that my mistake, or I'm going through a miscarriage? Is that something I've done which have led to this condition? Absolutely not. Please don't blame yourself for anything which has happened. Nothing, the activity or any food will actually lead to any vaginal bleeding or abortions. To be frank, most of the abortions which might happen in the first trimester, it's a nature's way of calling. That is, the abnormal babies are usually expelled in the first trimester. So it is not your fault, it is just the nature.